Good evening everyone. I am Dr. Aaishwari Durge, a consultant obstetrician, gynecologist, infertility specialist and laparoscopic surgeon working at Sreemanju Hospitals, Kukatpalli. So today I want to talk about the infertility in our population. Infertility basically means inability to become pregnant with at least 12 months of natural try during a fertile window, that is during the fertile period of the menstrual cycle. And this problem is usually seen in around 8 to 12% of a general population who are in reproductive age group. So those who are willing to bear child in the reproductive age group, this infertility affects to around 8 to 12%. So infertility doesn't mean the problem is only in women. So infertility has causes which can be women, men, or it can be no problems in both of them, but yet they are not able to have a pregnancy. So if I can say on average 30% of the problems are with women, 30% of problems are with men, and 30% remain unexplained. This is how it goes. So there can be problems in men, like the problems with the semen, the sperm count, the sperm motility, the movement of the sperms, or the normal or abnormal forms of the sperms. And when we come to women, so women might have different problems, like there can be hormonal problems which are most common, like PCOD, which makes the egg not to be released on time. And then there can be thyroid problem, there can be excess weight gain, there can be prolactin, which is a hormonal imbalance again, or there can be a very low egg reserve for that age of the patient. Then there can be some problems like the one with the fallopian tubes. The tubes are not open, or they are damaged, or they are blocked. There can be problems with the uterus. Uterus means there can be problems like polyp, there can be a fibroid in the uterus, or there can be some infections which are not allowing the pregnancy to happen. And there can be general diseases like endometriosis and other diseases like diabetes, hypertension, which are not allowing the pregnancy to happen. So these are usually the most common causes we encounter. Even in today's era, we are seeing an increasing trend of endometriosis also for the as a reason for infertility. So here at Sreemanju Hospital, we deal with all sorts of infertility issues. We have a good panel of investigations which can tell us what is the reason, and accordingly we can offer the variety of treatments, like whatever is needed for the patient. If it is hormonal imbalance, if it is PCOD, if there is any tubal problem, we deal in all sorts like ovulation induction. We can have follicular studies, we can do IUIs, and we can do any laparoscopic surgeries needed which are important for the patient to help them conceive. And also the male partner who has any sperm issues, there can be medicines which can be given for the semen parameters to improvise, and also if any other issues we can deal with. So you can visit us for any of the infertility problems.